Welcome back. Today, we're going to talk about sex. So, first thing we should discuss is what safe sex is and how it is defined. In short, safe sex means taking steps before and after you have sex to ensure you're preventing an infection either to you or your partner. Another common phrase that is used when discussing safe sex is safer sex. Safer sex focuses on personal health, sexual growth, and protecting yourself and your partners from sexually transmitted infections. However, it is under discussion by many healthcare professionals whether there is such a thing as safe sex, as any and all forms of sexual contact carry some risk. But in general, it is considered safe if you're having sex with only one partner who is only having sex with you, and neither of you has a sexually transmitted infection. In our first video, we briefly discussed abstinence. A primary focus of Congress, as well as schools across the country, is to place an emphasis on abstinence education. But what is it? Abstinence is when you don't have sex. It is important to keep in mind that abstinence and actions associated can mean different things to different people. What do I mean by this? Outer course activities are those besides vaginal sex, such as kissing, massage, masturbation, dry humping with clothes on, anal sex, or oral sex. Outer course is 100% effective in preventing pregnancy so long as no semen enters the vagina. However, it is not recommended to use outer course as a means of preventing STIs, as many of the infections are easily transmissible in these ways. Another interpretation of abstinence is fertility awareness, which is when people choose to partake in abstinence occasionally on the days when they're fertile but have vaginal sex at other times. All this in mind, abstinence is the only 100% effective way to prevent pregnancy and STIs, but it only works if you're actually abstinent. Whatever the reason may be, there are many ways to prevent pregnancy. First and foremost, of the most common is the male condom. A condom is used as a barrier to block the sperm that would try to fertilize the egg, and when used correctly are 98% effective in preventing pregnancy. But they're only around 82% effective in preventing pregnancy in reality because people do make mistakes. Correct use of condoms can also decrease the risk of gonorrhea, chlamydia, syphilis, and HIV and AIDS. It is suggested to use a condom whenever you have oral, anal, or vaginal sex because STIs are not only spread through the genitals. Before using a condom, it is important to ensure that it does not dry out, damage, or pass the expiry date. There's also another less popular type of condom, the female condom, and it consists of a polyurethane sheath with a flexible ring at both ends and an opening at one end. You can insert the female condom by placing the closed end into the vagina, push as far into the vagina as possible with 2 fingers, and adjusting the outside to ensure that it is lying against the outside of the vagina. To remove, you can twist the condom at the outer end and pull it out, ensuring that no semen enters the vagina. During insertion, it is important to ensure that the penis doesn't slip between the vaginal wall and the condom. However, female condoms do have a higher failure rate than male condoms, where in 100 people who use the type of condom, 21 of the female condom users would become pregnant, while only 18 of the male condom users would. Female condoms are also less accessible. However, there are some pluses to using a female condom. It can be inserted 8 hours before sex, it can be used during your menstrual period, and it can reduce the risk of HPV. With this in mind, the male and female condom should not be used at the same time, and you should never flush a condom down the toilet. Another reason that may contribute to errors involving condoms is the wrong use of lubricant. When looking for a lubricant to use with condoms, you should try and find one that is water-based. This means that petroleum jelly, baby oil, some creams, and oil-based lubricants cannot be used with condoms. Some condoms are coated with a layer of spermicide, which is a chemical that kills sperm. Spermicide can be purchased at the drugstore on its own and is found in creams, films, gels, and suppositories. But regular use of it can irritate sensitive areas, which can then increase your risk of infection. If you want additional protection from pregnancy, you can use a condom in conjunction with another type of contraceptive or birth control. But what exactly is birth control? And how many different types are there? Birth control is a way for people to prevent pregnancy. There are many different options, but let's begin with the birth control pill. The pill uses estrogen and progestin to inhibit ovulation or stop the release of the egg, and to thicken the lining of the cervix to prevent an egg from hanging around for possible fertilization. Some advantages of the pill is that when taken correctly, it is 91% effective, and it can reduce menstrual cramps, lighten periods, lower your risk or prevent an ectopic pregnancy, acne, cysts in the breasts and ovaries, and bone thinning. It can also make your periods more regular and easier to predict. But with every advantage comes some disadvantage, and those for the birth control pill include you have to take it and remember to take it every day. There can be negative side effects such as sore breasts, nausea, and headaches, and estrogen-containing contraceptives can increase the chances of suffering from a blood clot. Other than the birth control pill, contraceptives that are also highly effective include the vaginal ring, the birth control shot, the IUD, and the birth control implant. The vaginal ring works via a small, flexible ring that is placed in the vagina that releases the same hormones that are in the birth control pills, which are absorbed through the vaginal lining. Like the pill, the vaginal lining is also effective in preventing pregnancy 91% of the time. It also has similar effects to the pill, and you only have to change it once a month. Because the vaginal ring's hormones are similar to those in the pill, the negative side effects are similar as well. The birth control shot is 94% effective when used correctly and is convenient and private, as you only have to remember to get it once every 3 months. The shot can also make you get your period less often. If you're looking to become pregnant soon after stopping the dosage, however, this may not be the birth control for you, as it takes up to 10 months to get pregnant after stopping the birth control. Another type of birth control is an intrauterine device, or an IUD. The design and hormones of the IUD change how the sperm moves in the vagina and can last from 3 to 12 years. They are also 99% effective. People choose an IUD over other forms of birth control because of its convenience, it can make your periods better, and the copper IUD does not contain hormones, and it can be used as an emergency contraceptive. Side effects of the IUD include those typical of other forms of birth control. One of the last forms of birth control that we're going to discuss today is the birth control implant. Some advantages of the implant is that its effectiveness is 99%, and the fact that it is convenient and private, and it can make your periods better. And it only contains the hormone progestin instead of progestin and estrogen. The implant has roughly the same side effects as other forms of birth control, but it only has to be changed once every 5 years. Before we talk about other different types of contraceptives, it is important to note that all these forms of birth control discussed today do not prevent STDs. Therefore, the best way to prevent pregnancy and infection is to use a condom in conjunction with your preferred method of birth control, if you choose to have one. Our last form of birth control that we're going to discuss today is probably one of the most notable, and it is the emergency contraceptive, the most common being the Plan B morning after pill. The pill works best at preventing pregnancy after unprotected sex if taken within 3 days. You can take the morning after pill up to 5 days after unprotected sex, with decreasing efficacy. Some of the side effects of the pill include upset stomach, dizziness, or abnormal periods. Plan B is sold over the counter and you don't need a prescription to purchase. With all these forms of birth control in mind and preventing pregnancy, it's up to you to choose which one fits best. Thank you.